I'm Lin Chang. I'm a gastroenterologist on faculty at the Division of Digestive Diseases at UCLA. That's University of California in Los Angeles. And I'm here at the Digestive Diseases Week meeting 2011. My area of expertise, both clinically and for research, is functional gastrointestinal disorders, particularly IBS or irritable bowel syndrome. Now, as you know, this is a very common condition. It's a complex disorder. There's multiple factors, and there's some exciting research and information that was presented at the DDW this year. So I want to tell you a little bit about what's going on. There were some clinical review sections where they'd review treatments, how to identify and diagnose these patients, how do you treat the constipation patients, how do you treat the diarrhea patients, but also, there was some exciting new research that was presented. There was some data on looking at genetic factors. Are there certain genes that are associated with IBS, or in particular, abnormalities in GI function, how fast the bowel moves or how slow, different symptom subsets, because we know this condition is a heterogeneous condition. So are there certain genes that are associated with these different subtypes? That's some of the research. The other research that was being presented was, are there abnormalities in the intestinal lining, whether with the small bowel or the colon, in these functional GI disorders like dyspepsia or irritable bowel syndrome? There's some evidence that there's an increased permeability of the intestine in the colon. And if you take little biopsies of the colon, you can see these abnormalities, either from a molecular basis or through other types of physiologic studies such as Using chambers. So that's kind of exciting. There may be some increased reactivity in the colon in IBS patients. Other exciting news was new treatments. There are traditional treatments for irritable bowel syndrome. There were some new therapies that are being developed for IBS. You probably are familiar with rifaximin, that is not approved in any country as of yet for irritable bowel syndrome, but there's a lot of information to suggest that it is effective in a subgroup or some patients with non-constipating IBS. So constipation is not the predominant symptom. A new medication that has completed phase 3 clinical trials is linaclotide. Linaclotide is a medication that has been shown to be efficacious in chronic functional constipation and also irritable bowel syndrome with constipation. The data was presented for irritable bowel syndrome. It was quite interesting. This drug, which is a guanylate cyclase C agonist, increases chloride secretion in the lumen of the gut and promotes transit. It improves multiple symptoms of irritable bowel syndrome with constipation. There was also some evidence for non-pharmacologic therapies, expressive writing, mindfulness meditation, and these are very interesting types of therapies for the treatment of these patients. And many times we have to combine treatments to make them more useful. There was also one other new agent. It was a ileal bile acid transporter inhibitor. Is IBAT inhibitor. It decreases the reabsorption of bile acid in the ileum so that bile acids go into the colon, have a more cathartic effect, and can improve symptoms in chronic constipation. They haven't yet studied IBS with constipation. There was a little bit more information on lubiprostone, as you know, has been shown to be effective in chronic constipation and IBS with constipation. And lastly, there were some studies on brain imaging. We know that IBS is a brain-gut disorder. There are some findings we see in the gut, and there's also some findings in the brain that show this altered activation pattern in IBS patients in response to various stimuli or even at resting state. So all of this information and research is showing that IBS is a disorder of an altered brain-gut axis, and that there are different targets along the brain-gut axis that we can try to help our patients and improve their symptoms. So overall, it was a great meeting, a lot of new information, and I'm sure that they'll be made available to you for those of you who missed the meeting, but thank you very much.